Namaste, everybody. Welcome to Yenri. Today, we are going to discuss about Sudep, that is sudden unexpected death in epilepsy. Namaste, I am Dr. Mayur V. Kaku. I am a neurosurgeon and I am a certified yoga therapist as well. I have been in the field of neurosciences since last 11 years and have been practicing yoga since childhood. So it's more than 20 years of yoga practice. When we become more conscious, our priorities change in life, and we feel like contributing to the society and create more and more awareness where the diseases can be prevented, catastrophes can be avoided, and one can lead a healthy and a happy life without medicines, without surgery, or one can lead a healthy and a happy life with correct medicines and correct surgical interventions. Recently, I lost one of my colleagues at my hospital. Her name was Betsy, and Betsy is the reason why we are all here together. Betsy was in her late 20s and she was a known case of epilepsy. Due to the stress of the work which she was handling and because of the irregularities in the lifestyle, she was not taking medicines correctly, or maybe she was not able to comply to the medicines correctly. I'm not saying that is the reason for her death, but she left all of us few days back and she was found dead. That is what had happened. This is a very well defined and very well discussed topic, that is sudden unexpected death in epilepsy. Now, death itself is a very intriguing concept. The time we have understood our existence, we have feared death, all of us. In the practice of yoga, we consider the fear of death as one of the obstacles, one of the uh, you know distractions in the practice of yoga. Raga, dvesha, asmita, abhinivesha, like that we have some of the kleshas. So in that, abhinivesha is fear of death. Now, death can happen not only because of epilepsy, but it can happen because of accidents also, because of sudden infection also, as we saw in the corona pandemic. So there are multiple reasons because of which death can happen. But today's discussion is about sudden unexpected death in epilepsy. So what I will do is I will share the screen with all of you and I will go through some of the research papers which are comprehensive review papers through which you will get correct idea of what is going on in epilepsy. Now there are some of the influencers out there who themselves consider themselves as advocates of patients and diseases and all these things. We as doctors know, we have, I will admit this, that we have failed to communicate properly with our patients. That is where I have started these channels and I have been coming live and I have been speaking on various topics as much as possible so that we all come to a better understanding of the diseases around us and do better things. However, what happens is because of frustrations which happen amongst patients, because of overworked healthcare system. What happens is some of the patients, they go into the mode where they start rebelling against the whole healthcare system. They start speaking whatever comes to their understanding. They develop distorted understandings and they start putting things which are not correct. And that is where is our role as medical experts, to bring in light towards all these topics, so that you do not get distracted, you do not get deviated. And please understand things properly. Please understand things through proper references, not through some random uh, you know woke personalities and all these things. I have all empathy with them. I know that many of the people, they suffer, but sometimes no, they cross the lines and they start influencing people in wrong manner. So we all have to respect the established systems through which the knowledge is being generated, through which the progress in the healthcare is being done. Without wasting much time to explain why I am here, I will go into the subject and I will start explaining things to you so that we can move forward. Okay, just a second. I am bringing the screen. Okay, so the whole screen is being shared now. As you can see here, I will share this first information about epilepsy through World Health Organization. The key facts in the morning also I had shared with all of you, that epilepsy is a chronic non-communicable disease. So if somebody touches you, the epilepsy does not happen to you. Okay, so if a person with epilepsy touches you, it does not spread like that. Okay, it's a disease of the brain that affects people of all the ages. Approximately 50 million people around the world have epilepsy, and one of the most common neurological disorder globally. 80% of the people who have epilepsy live in low and middle income countries, and 70% can live seizure free life if they're properly diagnosed and treated. Now, one of the most common challenges we come across is people not revealing. Even educated people do not reveal that they have epilepsy. And that is how recently, like, highly educated family, lady is in her 50s, and still they have taboo that they will not share the information with the family members and so on and so forth, because they have a daughter. And even if daughter does not have epilepsy, they think that mother's epilepsy may lead to reduction in the proposals for the daughter's marriage. See, these are not correct things. You should discuss medical issues upfront. The person with whom you are getting married, and if you find out that there are some issues which were there before marriage and were not discussed, will feel betrayed, will feel cheated. Please do not do this. That's not a good foundation on which marriages are performed. Okay, then the risk of premature death in people with epilepsy is up to 3 times higher than that of the general population. This we have to understand. Three quarters means 75% of the people with epilepsy in low income countries do not get treatment that they need. Oh, that's a big number. One of the things is not able to diagnose properly, not able to understand the severity of the issue, that it requires treatment, and doing some treatments which are not correct. For example, people think that if they take medications for a long time, their body will get damaged. No, there are many safe drugs which are available, which can be taken, and through which these seizures which happen can be completely controlled. And because of that, they will take some other systems of medicine which are not as effective as right now in terms of allopathic medicine. Okay, In many parts of the world, people with epilepsy and their families suffer from stigma and discrimination. Definitely in all the parts of world, it happens. In developed countries also, and in developing countries as well. Please understand that diseases, these kind of problems can happen to anybody, and anybody can and can anybody can have this and can manifest this at any age. Okay, there are sometimes no reasons for this. There are sometimes reasons, like somebody would have developed infection in the brain, or somebody would have developed granuloma in the brain, or somebody would have developed some other kind of manifestation like tumor in the brain. At that time, if you avoid meeting a doctor, avoid investigating the problem, you are going to fall in more and more trouble. Okay, so here some very simple seizure episodes are result of excessive electrical discharges in the group of brain cells. Different parts of the brain can be the site for such discharges, and seizures can vary from briefest lapses of attention to muscle jerks to severe prolonged convulsions. Seizures can also vary in frequency from less than one per year to several per day, and sometimes it persists. It's called status epilepticus. One seizure does not signify epilepsy. Up to 10% of people worldwide have one seizure during their lifetime. Epilepsy is what? Having two or more unprovoked seizures. So once it has happened, it does not mean that you are epilepsy patient. Please do understand this. Epilepsy is one of the world's oldest recognized conditions with written records dating back to 4000 BCE. Fear, misunderstanding, discrimination, and social stigma have surrounded epilepsy for centuries. And this stigma continues in many countries today and can impact on the quality of life for people with disease and their families. So we see that, and that this emotional aspect, no, many people who are not doctors, many people who are just fake advocates of the disease, they are encashing your emotions, and they are spreading various lies about the subject, and at the same time they are selling products to you. They will sell coffee mugs to you, they will sell shawls to you, they will sell t-shirts to you, and it will create some kind of cult following. Please give us, the doctors, a chance to communicate in a scientific manner with all of you, and please do listen, please do understand the subject scientifically, and through that, please try to solve your problem. Please do not just go on for that cult mode. It is very difficult for all of us also to maintain our confidence, our enthusiasm to serve all of you. These are signs and symptoms and all these things. I'm not going to waste much time in that, because our topic of interest is Sudep, that is sudden unexpected death in epilepsy. Epilepsy is not contagious. This WHO also has to write that as the first line, because we know all across the planet there is a stigma. Brain damage from prenatal or perinatal causes: loss of oxygen or trauma during birth, low birth weight, congenital abnormalities, genetic conditions associated with brain malformations, a severe head injury, a stroke that restricts the amount of oxygen to the brain, an infection, as I was mentioning previously, meningitis, encephalitis, neurocystic psychosis, a brain tumor, and certain genetic syndromes. Okay, and as we saw, 70% of the patients we can manage with medications. Okay, and sometimes we may have to do surgery. Surgery is the last option. We have very good protocols for diagnosing a patient, from diagnosing to treatment, and then from treatment, if multiple medications are not working, we consider them for surgery, and we find out whether the surgery will benefit the patient or not, and then we perform the surgery. Many different surgeries are performed according to the seizure types, according to the types of the seizures. Okay, Prevention is always better than cure. We always have to learn this aspect. We neglect this aspect. So I would like to read this para so that you all learn to achieve the preventive aspects. Okay. So 25% of epilepsy cases are preventable. For example, head injury. Head injury can be prevented. Please remember to wear a helmet. Please remember to avoid any head injury. Please remember to drive safely. So many small things you do, automatically your chances of not developing seizures due to head injury are going to become more and more. Adequate perinatal care can reduce new cases of epilepsy caused by birth injury. For that, the prenatal checkups and all these things are extremely important, and they are defining the use of drugs and other methods to lower the body temperature of a feverish child can reduce the chances of febrile seizures. So fever aata hai means you have to control the fever as fast as possible, find out why fever has come, and address the issue. The prevention of epilepsy associated with stroke is focused on cardiovascular risk factor reduction. Example, measures to prevent, control high blood pressure, diabetes, and obesity, and avoidance of tobacco and excessive alcohol use. So tobacco and alcohol definitely we can stay away from. We can develop a healthy lifestyle that will help us to prevent stroke, high blood pressure, diabetes, and obesity. Why don't we do that? No, because we are getting allured by various food organizations, food companies, food industry, and many of us, we get stuck with these food industries. You see in the metros, strategically these food industrial aspects, you will see strategically, you will see the big chains of food, they are opening their outlets just in front of schools, just in front of colleges. Very sad. Central nervous system infections are common cause of epilepsy in tropical areas where many low and middle income countries are concentrated. Elimination of parasites in these environments and education on how to avoid infections can be the effective ways to reduce epilepsy worldwide. For example, neurocysticercosis. So hygiene and elimination of parasites, beautiful ways of avoiding seizures in our lifetimes. So there are social and economic impacts of this, which we can discuss, and human rights issues are also there. All these things we will keep aside for a while because we have to discuss the topic of interest. Today's topic of interest is sudden unexpected death in epilepsy. So this is the website. Previous website was WHO, World Health Organization. This one is Centers for Disease Control and Prevention, that is cdc.gov. Okay, one of the highest authorities in terms of healthcare, in terms of understanding diseases and taking care of the health of the people all across the planet. For some people living with epilepsy, there is a risk of Sudep. Sudep refers to the death of the people with epilepsy that are not caused by injury, drowning, or other non-causes. Okay, and 1.16 for every 1,000 people with epilepsy, there is a chance of Sudep. It's very alarming, and we have to understand that in detail. Most but not all cases of Sudep occur during or immediately after a seizure. Breathing, obviously what will happen? Breathing will stop. That stoppage of breathing is called apnea, and if it happens for a longer duration of time, the oxygen levels go down, and because of that, what will happen? Suffocation and death. Heart rhythm, many people may cause a dangerous heart rhythm at the time of seizure and can create cardiac arrest or some other manifestations like embolism and so on and so forth. So Sudep may result from more than one cause or a combination of both involving breathing and abnormal heart rhythm. Risk factors: uncontrolled frequent seizures. Every time one person has a seizure, there is a risk of Sudep. Generalized convulsions, also called as tonic-clonic or grand mal seizures. Full body seizures, you can say it as. Other possible risk factors may include seizures that begin at a young age, like in case of Betsy, it was for a young age only, and many years of living with epilepsy, missed doses of medicine. This is very, very important, and drinking alcohol. These two are very important in terms of young adults, and they have to understand this. What we can do to reduce the risk of Sudep: ask a doctor. Do not visit these YouTube videos, and my YouTube video is for awareness. After this, you should contact your doctor. After this, you should meet your neurologist. After this, you should meet your physician and understand these things in further detail. This is only for the sake of awareness. This is for the induction of curiosity within you, and that curiosity should be satisfied through a proper in-person consultation with anybody who is nearer to you, who is your family physician or who is your neurologist, anybody. Okay, then we are seeing about how we can reduce the risk of Sudep. Avoid drinking too much of alcohol, avoid having a lot of stress, and then get enough sleep. Circadian rhythm needs to be managed properly. Okay, we will go into the details of all these things as we go through research papers. Okay, so these are the things which you can ask to your doctor. That is, what is my risk of Sudep? What can I do to reduce my risk? What should I do if I forget to take my anti-seizure medications? Should we consider changing my current seizure medicine to better control my seizures? If we decide to make a medicine change, what medicines might provide better seizure control for me? Are there any specific activities I should avoid? What instructions should I give my family and friends if I have a seizure? Who can my family and I contact locally to receive information and training in seizure first aid? This is very, very important. Okay, learning is extremely important. Now we will go into the aspects of these research articles, review articles, beautifully written. See, this is a review article. Okay, and this review article is written by Orin Devinsky, Dale, David, Samden, George. Okay, they are all from Department of Neurology. Here you can see, and from New York, from Atlanta, from Cleveland, Ohio, and so on and so forth. Okay, now what they have written: Sudep can affect any individual, but most common is 20 to 45, the age range of Betsy also. Then seizures especially can do what? Can especially focal or generalized onset tonic-clonic seizures are most common cause of death amongst children and adults with epilepsy. I have marked already. I've gone through this paper for you. What important words are there that I have marked, and you can read through this. Despite a 5 times increase in the number of research publications. See, we as doctors know we are very open, and we always we have that tendency to explain to all of you that there are limitations for all of us to understand the human existence. Here in this paragraph also you will see, despite a 5 times increase in the number of research publications related to Sudep during the past decade, public health agencies cannot accurately track the Sudep incidence, limiting the opportunity to perform population-based intervention trials. Thus, we do not know whether Sudep rates are stable, rising, or falling. See, this is international journal where, frankly, it has been said that, see, this is the situation. Why this situation is there? it is from both the sides. Stigma, then we try to convince, but there is something in between doctors and patients which is not so transparent, maybe because of previous experiences, maybe because of the political interventions where politicians want you to feel that you are cheated by doctors, so you will feel that no, doctors are doing like this, and then you will have always have one question mark, one raised eyebrow, that that degrades our confidence. Okay, so here is this definite sudden unexpected death in epilepsy. So how it is happening? Witnessed or unwitnessed, somebody may be there or may not be there. Non-traumatic means there is no head injury, there is no chest injury, there is nothing. Non-drowning, there is no drowning in the bathroom or in the swimming pool because of the seizures. And then that occurs in benign circumstances in an individual with epilepsy with or without evidence of a seizure, and excludes documented status epilepticus in which postmortem examination does not reveal a cause of death. Sudep plus, where you will find the combined effect of both the conditions, and direct observations or recordings of terminal event did not prove the concomitant condition to be cause of death. Okay, concomitant condition can be there. Probable Sudep, but without autopsy, means it becomes probable if autopsy is not performed. Then possible Sudep, competing cause of death is present apart from sudden unexpected death in epilepsy. Near Sudep or near Sudep plus, who survives resuscitation for more than an hour after cardiorespiratory arrest and has no structural cause identified after investigation. Not Sudep, clear alternative cause of death is identified. Unclassified, incomplete information, impossible to classify. Okay, so here we go. Sudden cardiac deaths occur most often in the morning while the individual is awake, except for the patients with obstructive sleep apnea. So obstructive sleep apnea who has, they will die during their sleep. Okay. Then this sudden cardiac deaths, they differ and from the Sudep, sudden infant death syndrome and sudden unexpected death in unexplained death in childhood, which are largely witnessed in the bed during sleep, more common in men, okay, or more common in males. So Sudep, you can see here, occurrence during a sleep period is present. Prone position chances are more. Unknown idea about low birth weight and premature birth. Males have slightly higher chances. Exposure to smoking, we do not know. Illness or fever shortly before death is absent in Sudep. Okay, routine autopsy, everything you will find will be normal, and method of diagnosis is exclusion. And theoretical mechanisms are cardiac, respiratory, and arousal related explanations are there. Potential link to serotonin system is there. We will discuss about it in a bit. And then there is a history of epilepsy, definite history. But however, in case of SIDS and SUDC, it is not there. Sudden infant death syndrome and sudden unexplained death in childhood, we don't have history of epilepsy. But we can find that the history of febrile seizures may be there. Okay, any age it will be possible to have Sudep, but in this infant and all less than 1 year, then childhood it is 1 to 5 years. Okay, so these are the things about sudden deaths in children. Now we will go towards this. Yeah, so there are some changes you will find in the brain during autopsy. Focal granule cell bilamination was significantly more common in 47 of 112 unexplained deaths than in the 3 of 39 explained deaths. Okay, so it's very interesting to find changes in the brain of these patients because of the epilepsy or because of the changes in the brain epilepsy. A meta-analysis of 3 rigorous population-based studies of Sudep yielded a pooled estimate of 1.2 cases of Sudep per 1,000 people with epilepsy per year. Okay. Then what I can do is I can, increase the size of this. Okay. And non-adherence to treatment regimen. Risk factors. Please listen to this. This is very, very important. Non-adherence to treatment regimens. Sleep deprivation, alcohol withdrawal, increase in the likelihood of seizure occurrence for an individual patient. These and other risk factors, example, menstrual cycle and stress, probably combine. Is very subtle, but it has been given. It is not known why a certain level of sleep deprivation and anti-epileptic drug non-adherence provoke a seizure in one occasion, while increased levels of these factors do not provoke seizures in other occasions in the same patient. So everything is variable. Everything is variable. The strongest Sudep risk factor is poor control of primary or secondary generalized tonic-clonic seizures. Very important. If you are seizing, please visit your neurologist, please visit your physician, and please get it corrected. Okay. Alcohol misuse was associated with Sudep in adults more than 16 years of age, but not in children. Alcohol misuse, please be aware. If you are a FITS patient, please do not consume alcohol. Please seek expert advice. Please get rid of this alcohol problem. Okay. And however, strong risk factors for mental health disorder, alcohol misuse are strong risk factors for suicide, accidental deaths, and deaths by drowning in the people with epilepsy. So it's a very messy combination of alcohol, epilepsy, mental health disorder. Okay. Take the alcohol out of equation. Sudep most commonly occurs between the age of 1 to 3 years in Dravet syndrome, and with much smaller peak between 17 to 22 years. So this Dravet syndrome is because of some sodium channel abnormality, which is out of context to this lecture. Status epilepticus and acute encephalopathy are also common causes of death. So if some person has uncontrolled, non-controllable seizures, then chances of Sudep are high. There are many things which are given here. You can see this beautiful table has been given to understand what's happening. Absence of supervision, absence of repositioning or stimulation. So that is where the first aid in seizures is very, very important. Susceptible state, that is sleep, prone position, and then seizure. Susceptible host, non-adherence to medications, sleep deprivation, alcohol withdrawal, anti-epileptic drug discontinuation, all these things, they come towards seizures. Then post-ictal, once again, this absence of supervision and repositioning comes into the play. And late phase, nothing is there, then death or impaired arousal, which can lead to the issues with central midbrain and thalamus, leading to imbalances in acetylcholine, norepinephrine, and serotonin, basically neurotransmitters in the midbrain, then neurotransmitters in the medulla. Impaired cardiorespiratory function will activate those channels in medulla, and that is why what will happen, GABA, glutamate, adenosine, glycine, and serotonin related imbalances will happen, and through that death will happen. So this table, you can take a screenshot of this and start addressing the issues on the left side. Here these issues you have to address, and then automatically this whole cascade which happens, which leads to death, can be prevented. And time is extremely important. As you see, the time passes, the more chances of problems happening. Okay, if you catch it early, great. Okay. Cardiac and pulmonary abnormalities are common causes of Sudep at autopsy. In 52 patients who had Sudep with histopathological examination, 11 cases, 21% of the cases showed mild to moderate myocyte hypertrophy. That is, we are talking about the heart, and 22 patients showed varying extents of focal myocardial fibrosis. So once again, we are talking about heart-related pathological changes. So their hearts are not normal. Okay. You can see here some genetic disorders where brain, heart, lung, there are expressions, and because of that, there are, you can see here, post-ictal parasympathetic hyperactivity will lead to decrease in the heart rate, increased epilepsy severity. Almost in every disorder it is there. And you can see here neurological impairments also will happen. So these are, some of the histopathological slides where you can see what is happening to the neurons. Now, after generalized tonic-clonic seizures, impaired arousal and brain activity and sympathetic activation most often dominate. Generalized tonic-clonic seizures associated with Sudep might lead to prolonged or intense symptoms like depressed level of consciousness and reflex responsiveness to environmental hazard. So basically, once somebody should be there to supervise the person and to give the first aid in the seizures or in the epilepsy patient. Okay, like that. Thus, most SUDEPs in patients with refractory epilepsy are not seizure-induced sudden cardiac death. Changes in the heart rate and breathing are very common after GTC and focal seizure. However, SUDEP is very uncommon after generalized tonic-clonic seizures and extremely rare after non-generalized focal seizures. This indicates that although post-ictal cardiorespiratory instability might contribute, SUDEP also requires additional pathophysiological mechanisms or external stressors. So external stressors also we have to remove. Okay. Therefore, decreased heart rate variability and increased sympathetic tone-driven tachyarrhythmias are not primary pathogenic factors in SUDEP. Conversely, increased heart rate variability, vagal hypertonia, and central hypoventilation also occurred in mouse models. So this is about sympathetic and parasympathetic nervous system imbalance. So parasympathetic hyperactivity is very, very important. Okay. Here, periictal respiratory dysfunction is a common and can be severe respiratory dysfunction. And periictal apnea, oxygen desaturation decreasing to less than 90% in 33% of the seizures. This decrease in the oxygen saturation occurs commonly with focal seizures with impaired consciousness. So consciousness is, if it is fluctuating, then it's difficult. However, post-ictal rather than ictal respiratory effects of the seizures seem most strongly associated with Sudep. Okay, so this is one more. Now, while pulmonary edema, so here what we are seeing is now it is about lungs. Previously, we saw about the heart. Now we are seeing what is happening with the lungs. Okay, so pulmonary edema is a common pathological finding in Sudep, can occur post-ictally in patients. There are few human studies with the data of periictal pulmonary vasculature pressure. So data is not that great, but yeah, people are studying it. Seizures most often cause sinus tachycardia, that is increase in the heart rate, but can cause asystole, means stoppage of the heart. Bradycardia means decrease in the heart rate. Atrioventricular nodal block, once again decrease in the heart rate, or atrial and ventricular tachyarrhythmias means rapid increase in the heart rate. So these are some of the things which we need to understand. Heart, lungs, and the brain, three things. Okay. Sudep is far more common after generalized tonic-clonic seizures than focal seizures, possibly because consciousness and arousal responses are more severely impaired. So full-blown seizures, if they happen, this is going to be difficult. Okay. And that is where the cardiorespiratory dysfunction or the prone position with airway obstruction can happen. Sudep is most common in early morning hours in the bed, possibly because of combination of circadian rhythm, increased impairment of arousal after seizures arising from the sleep, 5 times greater risk of PGES from the seizures in the sleep, and greater cardiorespiratory instability during the sleep. Seizures induced in mice during sleep, especially rapid eye movement sleep, are more often fatal. Post-ictal airway obstruction by bedding in the prone position or other forms of positional asphyxia, neck twisted, obstructed airway, and increased likelihood of being alone. So never stay alone means one of the ideas which I can give you is never stay alone. Be with somebody so that somebody can help you out whenever it is needed. Okay. Then PGES and generalized absence of EEG activity observed in all patients who had Sudep in Mortimer's study. Okay, duration can vary widely but prolonged more than 50 seconds PGES might have greatest predictive value for Sudep, possibly explaining why one generalized tonic-clonic seizure can be fatally different to many others. So the absence of electrical activity, no, after the fits, it's extremely dangerous. This we have to understand. Okay. So there are so many things out of which I think basic ideas you all have got, and through this we need to now suppose SUDEP discussion, no, education. Less than 15% of patients with epilepsy, parents and caregivers receive systematic information about SUDEP and epilepsy related mortality. Yet more than 90% want SUDEP education. What happens? Nobody talks about it, or even if people want to speak, there is stigma. If I speak about death to you, you have come to me for a seizure episode or two seizure episodes, and now I have to diagnose you as epilepsy. And then if I start talking about death to you, that there is something called as Sudep, you will get scared of everything in the life, correct? So systematically we have to discuss and we have to bring things into light so that you know we can prevent bad events. We can prevent bad events. Now for that, healthy conversations are very, very important. You as a patient also should not be fearing me, and I as a doctor should not be fearing you. Oh, what will happen if I speak this to my patient? Will he feel offended, or will he go and sue me, this, that, and all? So if those kind of things they start happening, no, our mutual this it becomes very strange. It becomes extremely strange, and that is where no, we will not be able to discuss things in proper light. So we should talk to each other in a better manner. If we talk to each other in a better manner, we can help each other to create a better healthcare system. Okay. Here, this paper is their review article from Canadian Journal of Neurosciences, I think. And that a very beautiful table is there. That table I would like to share with all of you here. So potential modalities for prevention of SUDEP. Identify patient risk, GTCS, uncontrolled epilepsy, comorbid developmental delay. Okay, discussion with family, which we are doing. The internet family is very beautiful. We can discuss. We are all easily available to each other on internet. Early surgical referral. So if drug resistant epilepsy is there, early surgical referral will prevent such kind of things. Appropriate anti-epileptic medications have to be given. Stress to be placed on compliance. You have to take the medicine correctly. Now there are many mobile apps which will remind you, alarm clocks are there, everything you can use for your benefit. Lifestyle factors, avoiding sleep deprivation, stress and alcohol. See this we means this one needs to understand properly. People cannot have a very different lifestyle and think that okay, everything will be fine. ED advice during intercurrent illnesses such as GI concurrent drug and OCP intake. OCP means oral contraceptive pills intake. Train caregivers in home management of seizures. Yes, this is very, very important. Everybody should know first aid management of seizures. Nocturnal supervision, safety pillows, intranasal midazolam, turning from prone to recovery position and stimulating the patient. Basic life support training to willing caregivers of the high-risk patients, and seizure monitoring devices may be discussed with emphasis that we don't have evidence of SUDEP prevention. Okay. So this is one very beautiful paper which we saw now, and there is one more paper for neurologists. See, we all do all these things. Okay, it means lot of work keeps on happening. The problem is a lot of work keeps on happening. How much of it reaches to the normal public? That is where I found my niche. I thought that let me present to all of you all these things so that you become more aware and become more confident with your doctor. Not overconfident, not anxious, not fearsome, not fearful. It should be confident, empathetic, and it should be a positive discussion, positive conversation. It should be a conversation which should be learning for both doctor and the patient, and we can create a better world through that. Okay, so this is another paper where neurologists, they can read this paper and they can get the idea of what to tell and what to ask the patient. Okay, full questionnaire is there. Suggested Sudep discussion pathway for PWE, patients with epilepsy, people with epilepsy, persons with epilepsy, like that. Okay, so include early appointment, clinician, specialist nurse offered to discuss recent diagnosis of epilepsy implications, invite the patient to bring along the family member or a friend. Never go to the doctor alone. Means it will give a lot of confidence to you also if family member or friend is available. Ensure the patient is comfortable and give enough time for questions and discussion. Explore the understanding of diagnosis of epilepsy and its particular relevance to them. Establish what they know about possible risks, issues arising from epilepsy. If a relative or friend witnessed the person's seizures, ask what their thoughts were. Inquire sensitively if the patient is familiar with any direct adverse outcomes of epilepsy. Then bring this sudden unexpected death in epilepsy. Inquire if they would be interested in knowing more. Explain the entity, including that this is usually related to after effects of a severe seizure, putting a strain on breathing and heart function. So I think today we have understood that. And then offer reassurance that it happens in the range of 1 in 10,000 person years amongst the new onset cases and 1 in 1,000 in chronic epilepsy patients. So this point is very, very important. So you have to understand, the earlier the disease is managed, the better it is. Put this risk in context of other risks which we take in our daily life. So we all take risks when we are going down the stairs, when we are walking on the road, when we are driving a vehicle, when we are passing through some places, means so on and so forth. So there are risk factors of death apart from epilepsy in our daily routine life. Okay, we take a lot of risks in our daily lives. Cover core risk factors listed there, whatever risk factors we have discussed before this, and then highlight the indirect factors which could impact on seizure control, tailoring the discussion, and then ask the patient to reflect what they have learned, make notes and understand and keep all these things in the mind. Encourage reflecting, planning on how PWE will recognize a change in individual risk and when the action has to be taken. So these are the direct risk factors and indirect risk factors. So you can see excessive use of alcohol, other substances, non-adherence to the medication, sleep deprivation, irregular sleep pattern. So that is where irregular sleep pattern I have already discussed in detail. Very beautiful one lecture I have given, that was with Pink Hope Foundation. That was, can lack of sleep cause cancer? I had operated one person with brain cancer. He developed it after working in irregular shifts, and through that he developed brain cancer. Prescribed drug changes likely to result in worsening or loss of seizure control. Generalized tonic-clonic seizures is a direct, for more than 2 per year, is a direct Sudep risk factor. Nocturnal seizures and lack of surveillance, early age at the onset before age of 16 years. Treatment resistance defined as absence of 5-year terminal remission and long duration of epilepsy over 15 years. Okay, so these are the things. Positive reasons, it is patient's right to know, then we can reduce the risk, so on and so forth. And you can see here, you can read all these things. If you wish, you can contact me. I will email all these papers to you for your benefit. Okay, and now I am stopping to share. With that, we pause here. I miss our colleague, that is Betsy Lawrence, and we all should pray for her soul. We all should wish that we can make more and more people aware about this problem, and through that we can reduce what happened to Betsy should not happen to people who are in our circle. With that understanding, let us chant the Shanti mantra. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve bhadrani pashyantu ma kaschid dukhabhag bhavet. Om Shantihi Shantihi Shantihi. Let us pray that all of us, we pray for everybody's peace, prosperity, and happiness. Let us pray that nobody should suffer. Let us pray that we all live in peace and abundance. Thank you very much, everybody, for joining in. I would love to see some questions, to see some feedback, and to see some prayers for all of us. Thank you very much. Have a nice day. Have a nice life. Namaste.